Microphone check, 1 2 1 2. Test 1 2 1 2 1 2. Test.
Is he good, I guess? Okay. It is 1:17. We will call the May 9th meeting of the Tarrant County Hospital District to order. I appreciate everyone's patience and time. We were buying a little bit of time for Amanda and Dr. Duncan to get back from a lunch, and thank y'all for attending the United Way luncheon, which JPS sponsored and apparently has partnered up with United Way. I'll let you explain it all, but anyway, it was all very good. It was all very positive for the network. So welcome. I want to thank each of the board members who are always able to join us in special celebrations outside of our typical committee and board meeting structure. These celebrations and other special events are great ways to learn about the heart and passion our employees have for our health network's mission. There was no better celebration ever in my experience with JPS than the all-employee celebration that we held on, I guess, the 24th of April, celebrating JPS's exceptional workplace award by the Gallup organization. What's so important about this award is there's only 60 awarded in the world. So it's an incredible honor for JPS, and we had a whole heck of a lot of fun at the celebration that day. Seeing the happiness on employees' faces, and it wasn't just seeing it, it was physically feeling and hearing the pride that they have for JPS. It was a really cool experience. And it wasn't just the Chick-fil-A sandwich, which always puts a smile on my face, but it was real and just another reminder of the excellent team that we have at JPS. I'm so proud of this organization. I can't state that enough, and I want to personally thank Deborah Ferguson of NBC5 for emceeing the event and making sure that the public knows some of the good things that happen in this great organization. As proud as I am of this hospital, I'm equally proud of this board. We're a diverse group of people with very diverse backgrounds, and each of us has input into continuing to build excellence within this organization. Today, we get to swear in and welcome a new member to our board, but that means that we must also say farewell to a vital contributing member of our ranks. In the past, we've been great at welcoming new members, but we have never been that great at celebrating the accomplishments of those who leave. We don't get to choose our ranks, and that's fine. We know that we're all appointed to serve at the pleasure of our commissioner. But that doesn't mean that we cannot honor those who serve with anyone's most precious resource, which is their time. Zim Zimmerman and his wife Mac have been public servants for a long time. Zim's working career began as an engineer for General Dynamics in 1964, and he retired in 1999 from Lockheed Martin after a successful career in product and logistical support for the F-111 aircraft and Fort Worth's F-16. Managing employees and a $1 billion plus budget has never been a problem for Zim. After retiring from Lockheed, Zim set his eyes on local politics. And if you know Zim, he did not set out for fortune or fame, but for the love of service. He was elected to the Fort Worth City Council in 2009 and served diligently until 2017. He served as mayor pro tem of Fort Worth from 2011 to 2014. There are too many other boards and committees that he has served on to list, but I know from our conversations his affinity for serving on the MedStar board was one that was really important to him. JPS was lucky that Commissioner J.D. Johnson appointed Zim to our board in February of 2019. He has served us diligently since then and has served most recently as chair of our nominating committee and chair of our governance committee. Zim is at home today. He is recovering from a recent hip replacement surgery. I talked to him. He's doing well. He laments that he probably should have done that 5 years ago, but he is recovering well, and he's actually watching today's meeting live via YouTube. Otherwise, Zim would have been here in person. I don't know what camera's recording this, but Zim, I want to thank you for your years of public service. Thank you for your time and attention to the critical issues you helped this board face. Much of your work happened behind the scenes, and I know that you spent many hours working to make this health network better. Most importantly, Zim, thank you for your friendship, advice, and the occasional round of golf. You have been a great mentor for this Aggie, and I will forever be grateful. Zim texted me some comments that he would like me to share with you all. And if you'll beg me just one quick moment, I will open up there it is, and share with the note that he sent. And it's so small and my eyes are not so great. To the JPS Board of Managers, since February 16th of 2021, it has been my privilege and honor to be a part of the JPS Board of Managers. I have enjoyed getting to know and work with each of you. The JPS team is professional, dedicated, and dedicated to making JPS the very best, and I am proud of each and every one of you. Hopefully our paths will cross again soon, and I wish you all continued success as we move forward. I'm not sure if anyone here would like to say a word to Zim or pass on any congratulations to him, but I know he's watching, and you're welcome, and we'll do that now. And then we will give him a round of applause and thank him for his service.
I will say Zim is not only a leader, but he's very smart. And he was a huge help to me on the board, even though we had to endure another Aggie.
I know. All the Aggies are gone. I don't understand what happened.
Zim, I feel for you. I've been right where you are. You know, following up on the hip replacement surgery is not fun, but we're praying for you. We know you'll come through it with flying colors, and we will miss you, and congratulations, because you did a great job.
Thank you, Trent.
I'd like to say when I walked in this room a year ago, Zim was the only person I knew. And he was my city councilman for many years, and he and I worked on different city issues over the years, and it was just a great honor, Zim, to serve with you on this board for over a year. That's something I'll always cherish, is that time to serve with you, my city council person on this board. So, thank you for all you've done for Fort Worth and JPS.
Zim, it was great working with you. Zim used to call me and say, well, now I'm not giving you any advice, and he'd continue to give me his advice. But it was always in a very positive, friendly manner. So I really thank you, Zim. When I was serving as the chair, you were really helpful and great. So I will miss you, but I know you will. I will see you again. Zim and I go way back. He was my city councilman, and so. Get well and enjoy your time, because I know someone else will be calling you soon, okay?
Great. Thank you. Well, y'all please join me in a...
Can I say something?
Yeah, sorry.
I just want to say something. So Zim and I, that's my battle buddy, because we came in together at the same time. And so I really enjoyed working with him, and always his advice and his great stories and travel opportunities, and just the things that he lent to this board were fantastic. And it's going to be key and missed, and those are lessons I'll always learn. So thank you, Zim, for all you did, and for all you continue to do, and get well.
Zim, on behalf of JPS, I would truly like to thank you for your humor, for your timing, perfect timing, but most importantly, you always told us that we were doing an amazing job, and that meant so much to us. So thank you, Zim, from JPS.
Please join me in a round of applause for Zim Zimmerman. All right. Well, as we bid farewell to Zim, we have the good fortune of swearing in a new member. Appointed recently by Commissioner Ramirez, please let me introduce Mr. Dustin Austin. Mr. Dustin Austin is a lifelong resident of Tarrant County. He is an accomplished businessman who has founded and grown multiple land development and home building companies throughout his career. Currently, he owns and operates the largest custom home builder in DFW, Our Country Homes. From my neck of the woods, we're real proud of it. And he is the managing partner in many transformational projects across North Texas. Mr. Austin supports numerous charitable organizations in North Texas, including the Fort Worth Stock Show Syndicate, Eagle Mountain Saginaw Independent School District Scholarship Foundations, Bob's House for Hope, and many others. Mr. Austin is married to Rochelle Austin. I'm sure we'll all get to meet her at some point. Together, they have 2 children who attend Eagle Mountain Saginaw ISD in Northwest Tarrant County. He is passionate about local sports, the outdoors, and spending quality time with his family. I've had the opportunity to share a meal with Dustin, and he even joined us at our Excellence event in April. I know that he is excited about serving on our board, and he brings yet another diverse background that will help this organization. It is always a great pleasure to serve with people who believe that service is an honor and a privilege, and I know that this is how Dustin feels. So Dustin, if you want to come up, we'll do this swearing in, and then we'll get to the rest of our day. All right, so you can raise your right hand and repeat after me, and I promise, we talked about this, I'll go slow, because I'm a slow learner too. So
I,
Dustin Austin,
Dustin Austin,
do solemnly swear and affirm
do solemnly swear and affirm
that I will faithfully execute the duties
that I will faithfully execute the duties
of the position to which I've been appointed
of the position of which that I've been appointed
by the Tarrant County Commissioners Court.
by the Tarrant County Commissioners Court.
I will, to the best of my ability,
I will, to the best of my ability,
carry out such duties
carry out such duties
in a manner consistent with the Tarrant County Hospital District bylaws
in a manner consistent with the Tarrant County District bylaws
and by the laws of the state
and by the laws of the state
and the United States.
and the United States.
So help me God.
So help me God.
All right, congratulations.
Thank you.
You're locked into your sentence.
Congratulations.
Dustin, I don't know if you want to say anything. I don't want to put you on the spot, but you're welcome to at this time if you have anything you'd like to.
Yes, I appreciate the welcome arms of everyone. It's been wonderful so far getting to know a lot of you. A lot of you folks have reached out to me individually, and it's been very warm, very welcoming, and really grateful for this opportunity. So look forward to today's meeting, and yes, I'm here and committed, so appreciate this opportunity and look forward to getting to know those that I have not met. So thank you.
Great, thank you. I know I'm a little bit out of order. Everybody keeps telling me, and I know I'm taking some privilege here, so just bear with me. So since we've had some changes, I just want to outline this, and Lonnie will send it out to everyone just to update the committee rosters. Dustin Austin will fill the vacancy left by Zim's departure on Finance, Planning, and Investment. Dustin will replace Leonard Firestone on the Quality and Patient Safety Committee. DT will replace Zim as Chair of the Governance Committee. Blake Woodard will become the Vice Chair of the Governance Committee. Leonard Firestone will be added to the Governance Committee, and Trent Petty will replace Zim as Chairman of the Nominating Committee. I know that's confusing, but we'll send that out. Everybody can have that, so all the committee rosters are updated and everything.
Calendar appointments.
So, yeah. So anyway, thank you all for that, and for those, I think I spoke to everybody. Maybe I didn't talk to Trent, but since I threw Trent on planning and finance, he'll be able to handle nominating, no problem. Angela, if you would come up and do the invocation.
Good afternoon, everyone. Let us pray. Gracious God, we are here today in gratitude and in faith as we discuss topics that will keep JPS moving forward. Grant us clarity of thought, integrity in our communication, and a spirit of communication as we work towards our shared goals. Bless our endeavors and help us to be good stewards over the resources entrusted to us. Amen.
Amen. Thank you. If you'll join me for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I also did inform Dustin that the payment for service on this board is cookies. They still appear to be smaller than before, but we'll move on from there. Are there any citizens wishing to address the board today? Seeing none, we'll turn it over to you, Dr. Duncan.
Well, thank you, Chairman Fisher. Yesterday, I have to share this story. First of all, welcome, Dustin. We were having lunch yesterday, and I said to Dustin, the board has really tasked me with this revenue diversification. I've just been notified about some property. I'm wondering if you can build me kind of a country home development on there. And Dustin didn't blink an eye, I'm just telling you. So I think I have my requirement for revenue diversification, but welcome. This is an amazing board. And Roger, thank you. Oh, I think it was Roger or Trent that threw shade on me about the cookies, so continuing to do that.
They used to be really big cookies, okay? That's all I'm saying.
We never get it on time. So this was actually for Tim Davis because he says it's I'm serious. We have never gotten that one on time, so I may have to give it. But as Roger mentioned, as we continue to get loud about JPS, we want to thank all of you who attended our employee celebration. And we had so many employees who were able to attend that recognized us as the 2024 Gallup Exceptional Workplace Award. The award-winning journalists, as Roger said, NBC, Dallas-Fort Worth, Channel 5, weekday morning correspondent Deborah Ferguson was there, and she really shared her own personal story. And I think that's trying to rub it up there. Her own personal story and how important JPS has been to her and to her community. Special thanks again to the JPS board members who were in attendance there, including our chair, Roger Fisher, Dorothy DeBose, Amanda Arizola, Trent Petty, Blake Woodard, and our newest board member, Dustin, who also had opportunity. Leonard, I think you were also there, as I remember, okay? And did I get everybody? So it was a great celebration. In continuing our celebration on April 16th, the Tarrant County Commissioners Court presented JPS a congratulatory resolution for receiving the 2024 Gallup Exceptional Workplace Award. And so I want to thank Commissioner Brooks and the Tarrant County Commissioners Court for recognizing our JPS and the workforce here. And then we continue to be recognized on April 23rd. We headed down to City Hall. Mayor Maddie Parker and the Fort Worth Council recognized JPS and the members of our trauma and emergency department for continually responding to crisis and to emergency situations every day, always being ready. In particular, the council recognized our team members related to our team's response during the aftermath of the Salmon Hotel gas explosion. So once again, I'd like to thank JPS Trauma and Emergency Department for their continued exemplary service to Fort Worth, to Tarrant County, and to the North Texas region. And then today, we already have a picture up. Today, United Way of Tarrant County announced a groundbreaking maternal health initiative. It's called Team Birth, and Team Birth is a partnership with United Way and JPS Health Network to improve communication and teamwork during labor and delivery. Through our partnership with Team Birth, we look forward to implementing strategies that will lead to better maternal health outcomes and improved communication and teamwork during labor for the patient, family, and baby. And some of that data was shared. I believe all Oklahoma hospitals now are part of Team Birth. The data is just striking that this huddling around the time of birth, where the mom has her family, she may have her doula, but her support system surrounds her and she's very engaged in the decision, has really resulted in better outcomes, better experience, and better family experience, lower C-section rate, especially for African-American moms, and has really closed the gap on health disparities and inequities. So we are glad to be the first hospital here in North Texas, and we may even be in Texas, is that right? Okay, first hospital in Texas to be a part of this program that comes out of Harvard. So great, looking forward to it. And then, Dorothy, happy Nurses Week. While we know this week is nationally designated as Nurses Week, we really consider every day to be a time to celebrate our staff and especially our nurses. This time allows us to honor and appreciate our dedicated nurses for their countless service and the quality care they provide to our patients. JPS nurses represent the majority of our workforce. And so to our nurses, you are exceptional, and thank you for making a difference in the lives of every patient that you encounter. And I want you to enjoy this video that gives tribute to our nurses.
I don't think I could ever speak highly enough about our nurses at JPS. They work hard, they will do anything, they give it their all when they come into work. I see so many nurses that are just angels. I have been a nurse now for 11 years, working on 12. I love my job here at JPS.
I get to wake up every single day with a purpose to come and serve some of our most vulnerable patient population and provide them an opportunity that they otherwise wouldn't have through access to services and resources and knowledge.
We invest all of our knowledge base, our emotions, our compassion in making the best outcome we can for our patients. Because if you don't like what you do, you won't give the best care you can.
Every day, nurses make a difference. I feel like it's a nurse who's going to be there, the nurse that's going to know what's going on with you, that's going to see you from day to day, hour to hour, know whether or not you're changing, getting better, getting worse, the eyes and ears for that patient to communicate so that things can be ordered and interventions can be done. I just don't think you would fare well without nursing.
We are our best tool here. Despite what else they give us, it's us. Because, like you go to a med surg floor, they have all these, your medicines and your stuff, but it's us.
We are provided the opportunity to give back to our community and make a positive impact on our community and the patients that we serve. That it's an honor, a privilege, and a calling to be in nursing.
I mean, I find a lot of satisfaction doing what I do. Like, I can have a hard day at work, go home, but as tired as I am, I know that I help people each and every day. Someone can always put a smile on my face, and I hope I can put a smile on somebody else's face. But it's just great to come to a job where you just feel like you're making a difference, you belong, you're changing lives every day. And that's how I feel when I come to work.
We have the most phenomenal nursing peers and colleagues here at JPS. They are true superheroes. They are committed to our cause and our purpose. They are relentless. They're resourceful. I learn from each and every one of them. Without a doubt, if I find myself in a pickle, I can pick up a phone and call one of my fellow nurses, and they're going to lead me in the right direction.
When I can help a new nurse make a difference and find what their passion is and give the best care they can give, I think it'll all benefit in the end everyone. It's like a pay it forward. You give the best care you can. When it's your time, you'll get the best care you can get.
You never stop learning. So I just think that we just grow together and we become better nurses for it.
This has got to be the most rewarding thing I've ever done. I wouldn't trade it for anything. I guess from my point of view, nursing is always touching somebody, whether we realize it or not.
I want to say to my fellow nurses here at JPS that we indeed make a difference through our sacrifice, through our commitment, and through the service that we provide our patients and our community. Through our hearts, we absolutely make a difference.
I know, Dorothy, you're really proud of that when you watch it. I know Tim's mom is a nurse. Yeah, let's get loud. But thanks to all of you, because these are the people that you truly do support. So thank you. And with that, Chairman Fisher, I am finished.
Can I take a point of privilege?
Sure.
Okay. So I'd like to send a special shout out to the nurses. My sister has been, as y'all know, my sister's been in and out of JPS for the last several months. And so every single time her stay here, she usually here about 3 or 4 days. And so the nurses from everybody's always fantastic, always amazing. Shout out to our ER nurses. They are fantastic and very, very critical steps. Our CDU unit and our P4 units are amazing at what they do and being able to create an optimal bedside experience, as well as our physicians. So thank y'all so much. Happy Nurses Week.
Thank you, Amanda, for trusting us to take care of your family member. Thank you.
Thank you, and happy Nurses Week. We get the opportunity for various weeks to thank all the wonderful people here and all their various contributions, and all of those contributions count. And it's really great, and it's noticed with awards like the Exceptional Workplace. So I will move now for approval of the minutes, and thank you, Dr. Duncan, for your report. I move for approval of the minutes of the board meeting on April 11th. If there's any, got a motion by DT?
Second.
Second by Dorothy. Any discussion? Any notations? Seeing none, all in favor?
Aye.
Any opposed? All right, motion carries. Dr. Casey, it's your turn.
Thank you, Chairman Fisher. We have 2 items from the Medical Executive Committee for approval today. First, in your red folder is the May 2024 medical staff appointments and privileges.
Any problems or concerns that need to be moved to executive? Okay. All right. I'll call for a motion. By Tim, second? Second by Leonard. All in favor?
Aye.
Any opposed? All right. Yes, sir. Item 2.
And the second is an update for the delineation of privileges. I believe these have been to the board over the last 2 years. This is more of a cleanup of the forms for both neurosurgery and family medicine. There's a summary in page 11 and a summary on page 16 for each one.
Okay, we'll take the first one. The neurological surgery, I know it's in your board book. Do we need to give the exact name, or is it okay just to use the broad term?
I think you gave it.
Neurological, okay. There's numbers and filing things.
I said the wrong word, yeah.
So are there any questions or comments necessary on neurological surgery? Okay.
If there are, that's going to be.
Yeah. Well, if they are, we've assumed they'd come from you, so.
I had to look up half these words.
So I'll call for a motion.
Move approval.
A motion by Dorothy and a second by Amanda. Any discussion? All in favor?
Aye.
Any opposed? The motion carries. Thank you. Family medicine, which is also in the board book. Is there any discussion in regards to item number 2, family medicine? All right, I'll ask for a motion by DT and a second by Amanda. Any discussion? All in favor?
Aye.
Any opposed? And seeing none, motion passes. Thank you. We'll move on to the DT Wynn Show here for committee reports and action. DT, could you give us, please, the summary of the Finance Planning and Investment Committee meeting on April 25th?
Yes, Mr. Chair. We met on April 25th, and I have the privilege to sit in and chair the committee for Chairman Petty. And we were discussing, and we got the report from our CFO, Rory, that, believe it or not, the annual budget process for 2025 is underway. We barely finished the year, but anyway, and included in there is the Medical Home Southwest, the PEC, and the Las Vegas Trail Clinic will be onboarded during our fiscal year 25, and will be included in the budget also as well. From the review of the March financial and the utilization, admission were under budget, length of stay was favorable to budget, the emergency visit outpaced the budget while urgent care were lower than expected. from the primary care visit were slightly lower than below budget, while specialty care visit were ahead of budget. Commercial payer mix continued to be favorable. Cash collection was strong, and the connection enrollment continued to climb, and it is at 45,000 members now. So, great job there. Our CFO also presented a new finance dashboard with 12 metrics to help measure efficiency and network. And it's a great report, and we really enjoyed looking at the report from a dashboard perspective. Thank you for that. Net patient revenue and other operating revenue were over budget. Expense were under budget, and investment income was favorable to budget, for a total net income of $20.4 million, which is about $9.8 million favorable to budget also as well. Our days cash on hand was 432 days, and included in the total is 190 days of board restricted future funds. The committee approved the March 2024 unaudited financial report, and then on the portal you see the 10 contracts were presented, approved, and on the consent agenda today. And out of that, 2 of the contract were under the exemption to bid also as well. That's how I conclude that report.
Great. And Roy, I just want to thank you for that summary. I don't know the chart, and maybe the matrix you were talking about, that it gives you all the months, and it shows you. That's a great barometer for us as a quick 10,000-mile view to see where we are this month, where we are last month, where we are 2 months ago. On budget, above budget, or below. That was, to me, a really great chart. I appreciate having that.
Yeah, we really like the color-coded also as well, because sometimes up is not really good, and sometimes low is not good either. So
yeah, no,
that helps a lot.
I thought that was great. Any other discussion on those items? None of that needs an approval, but just wanted to make sure the board was briefed on what happened at Finance and Planning. DT, how about governance?
Governance committee met also on the 25th, and we acknowledge Zim's impactful leadership, mentorship, and stability over the past 2 years as chair. So it's a big shoe to fill in for Zim. Thank you, Zim. From our Chief Compliance Officer presented to us the risk register, emphasizing on 2 items: Medicare annual wellness visit compliance, and the other one is the business associate agreement compliance, which we normally call BAA. Medicare annual wellness visit aim to enhance overall health and detect potential health issue early. Our governance scrutinized 3 key areas there that are deemed to be risk: the proper documentation for claim justification, the restriction on certain exam codes alongside with the annual wellness visit, and the advanced beneficiary notice for the annual wellness visit. So the BAA challenges was facing difficulties in obtaining accurate BAA data for the network. So the Chief Compliance Officer proposed a manual review to rectify any identified gaps also as well. From cybersecurity update, our CIO, Will Showalter, brief us on the Change Healthcare cyber attack, as we're well known and very publicly acknowledged by and set up a lot of challenge for the financial side of it. It highlights actually the human error as the primary vulnerability. JPS network infrastructure design would have mitigated some risk compared to what Change experienced. So from the IT priority, infrastructure standardization, maintenance, and refreshment for enhanced security, and may consider external IT security support. In FY25, a detailed cybersecurity roadmap was presented to the governance committee as well. Our Chief Legal Counsel updated us on the workplace safety effort. Future updates on the workplace safety will transition to a quality and patient safety committee. Other matters that require approval, the committee unanimously approved 3 matters in April. Now on the consent agenda, one is Code of Conduct for Business Ethics. The second one was Corporate Compliance Program. And the third one was the PRV 200, Employee Access to Personal Medical Record. That concludes our report, sir.
Okay. Thank you. Does anybody have any questions in regards to the report on the governance committee? All right. Thank you for those updates, and thank you all for the work that you do on behalf or in those committees. A lot of the things that this board does happen in those committee meetings, so they're very important, and we appreciate your time and diligence in attending those as well. We'll move on here for an approval of a resolution on behalf of the Tarrant County Hospital District related to matters involving funds distributed by the Texas Opioid Abatement Fund Council. Is there a presenter for this?
Well, I will give the board just
Yeah,
a brief
please.
overview, and if we have any questions, then I'll ask Mr. McCready to join me. But as you know, we've been waiting for quite some time as a result of the opioid settlements to start receiving those funds. The Texas Comptroller has asked that those facilities that are participating would have a resolution specifically designating an authorized official to sign all of the documents in connection with those distributions. Those funds are specified for use in remediating the opioid crisis. And so we are requesting the board to approve the resolution that would authorize Rory McCready, our interim chief financial officer, as being the person that would make sure that we're using those for appropriate purposes.
Any questions, concerns? Call for motion? Oh, Tim, sorry.
And this is more of a legal question. Why are you smiling at me like that? So section 2, this is on page 27 of our material. I mean, it has those broad purposes. And I know this is the result of a lot of work, so thank you to everybody. Section 3 says we have to pay it back in the event of loss or misuse. I mean, I don't think we're going to lose the money. But do we have a concern about misuse and what that might mean? And are we going to get in a situation where we're at risk of having to pay this back?
Sure. So first thing I will say, this was a standard resolution that they kind of pushed out that the Texas Comptroller's Office was comfortable with. There is, while we had hoped when we filed litigation to recoup some of the funds that facilities felt like they had already expended in abating the opioid crisis, that we would just be able to get that money and, use it for other purposes. There were particular purposes that got articulated into the government code, so those are the appropriate uses. And yes, we do have broad language that says that we would have to return any the misappropriated funds from that perspective.
So we feel like it's broad enough, there's margin there that we're not going to be 2 years down the line having to cut a check to somebody for this.
We feel like it's broad enough, but that is part of Rory's job. And, we have history in terms of, just like we did with the COVID funds, we were making sure that we were using those for purposes that were permissible in accordance with the law. So that'll be part of his job for the accounting.
Congratulations.
Daphne, do
Only his job.
we have any sort of estimate of how much funds we might receive?
For later in the summer, and we think it's somewhere around 5.2 to 5.6 million. But the funds are very fluid as well. So as settlements occur, there will be future distributions, and the comptroller is kind of holding those funds as those settlements come in. And so it's a little bit uncertain as to the timing of future distributions. But yes, we know about the first one, but not subsequent ones.
Who offers you guidance on how the money should be spent? Is it from the comptroller itself, or are there other entities that are kind of guiding us using the money?
It is very well spelled out from the comptroller. For anything from naloxone treatment, medical assisted treatment, education, incarcerated treatment for incarcerated individuals. There's a long list. But yeah, it's pretty specific on what you can use it for.
Yeah, I was just going to say the medical associations also have come together to agree upon how to interpret the usage of those so that all hospitals can do this together and hopefully not be found, not using those funds appropriate. A lot of the hospitals, especially the public hospitals, feel that they probably already have a lot of that work going on, and so the monies will probably just help cover the existing work that's going on and probably will not kind of cover any future programs that we have. But yeah, the associations are working hard to get clarification.
Any further discussion? I'll ask for a motion.
So moved.
So moved. Approval?
Yeah.
Okay, move to approve by Tim? Second by Blake. Any further discussion? All in favor?
Aye.
Any opposed? All right, motion passes. Congratulations, Rory. One more thing.
Thank you, Roger.
Hang there for me if you don't mind. We'll move on to consent agenda. Everyone will notice on the consent agenda, there's a little bit more detail. This is just a quick synopsis of everything that's in our executive summaries that are in our board book. I wanted just a little more visibility, not only for us in this meeting as a quick reference, but for the general public out there. See how much money we're spending, to know that these monies are budgeted or unbudgeted, and to have an idea of kind of what they are going for. So I want to thank Dr. Duncan and Dabney and Lonnie. Thank you for making that quick change for us. I think this is just enough to just give us just a little bit more meat on the bones. So we'll move to the consent agenda. I had a call from Blake. You want to talk about one item and remove one item, correct?
Yes. I want to talk about item D under finance planning and investment, the contract, before we vote. And then under governance, I'd like to remove from consent item 2, corporate compliance program. And since that's so tied into item 1, they're kind of related, we might just hold off the vote on both of them until we have the discussion. So maybe move both of those from consent.
Okay. So I'll tell you what we'll do. We'll take finance and planning and investment consent, and then we'll do a subsequent vote after we discuss on the governance consent
Sounds good.
agenda. You wanted to talk about item D, so go ahead.
Yes, and I'm glad Rory's here because I've asked him to speak on item D. I wanted to visit on item D. First, I think it's the largest expenditure on today's agenda, and Roger and everyone that was involved in updating our agenda format, thank you. I think this is good not only for us as board members, but for the public. It makes it a much more usable agenda. Item D is not only the largest item, but it's an item of great importance to me. It deals with Smith & Nephew's leaf system. And I wanted Rory to talk to us a bit about that. But before he does, I'll tell you that this is very personal to me because last year, my dad entered the hospital for a 12-day stay at another hospital. And during that stay, he developed horrific pressure wounds, what we call bed sores. And even after he was discharged into the hands of very loving and capable skilled nursing staff at his residential facility, they could not stop the chain reaction that had started in the hospital. And I watched in horror as my dad literally just deteriorated and died in a matter of months. And it all started from a hospital stay where these pressure wounds began. And so when I saw this on the agenda, I know how critical this is for patient care. And I wanted to ask Rory if he would speak on not only the financial benefits of this contract, but the patient care benefits at JPS. So with that, I'll turn it over to Rory.
Sure. Thank you, Blake. About a year ago, my father had a stroke as well, and he was unable to turn himself. And a lot of that duty or a lot of that obligation fell on family, because if there was nobody there. So learned that routine myself. But LEAF is really statistically shown to reduce pressure injuries about 73%. Wow. And that's from their own internal data. It also increases the turn protocol adherence, which would be the frequency to about 98%. And so it is a wireless sensor that is adhered to the chest. and it monitors the turn of the patient. It also is able to record when the patient turns himself. And so it sends messages that's to a monitor remotely, and it can actually detect a recent turn would be green, so that patient is lit up as green. An upcoming turn is yellow, and then a past due turn is red. So it's some very great technology for the staff, and then it's also embedded into our EMR as well. We did utilize this in our critical care areas, and we showed about a 53% reduction in pressure injury in the critical care areas. And the return on investment, the way we looked at that was we looked at the cost of what it took to care for a patient with a pressure injury, and then how that cost was lowered once we started utilizing LEAF on more or less a pilot. So this was a very good pilot for us. It was proven, so we are moving forward with the full-blown contract. ROI was about, on that small sample of patients, it was almost $1 million in return on investment. So, questions?
You didn't even need me.
Yeah.
At all.
Well, you never know.
Is this standard of care at other hospitals? Are they using LEAF?
The data that I read is very, it's in limited hospitals. So we would be on the forefront. I think the number was 57. So that's not a lot when you consider, I think there's more than 4,000 hospitals in the U.S.
I think people get scared by the price tag, but really understanding the value that, the ROI on it, it definitely is an investment up front. So much so that we are expanding it to other areas where patients, are unable to get up and move. Obviously, the ICU, it's pretty straightforward, but even in our PCU units, our step-down units, we're expanding it to that population as appropriate as well, so.
And so is this a new program for us, or we did a pilot?
Yeah, we started it during COVID, which I can tell you probably wasn't the best time to start something new. And so we kind of reinitiated coming out of the pandemic with the reporting, and obviously the integration into Epic came post-COVID, and that's been a game changer as well because it documents in our electronic health record as well, the turns as well as our documentation of helping with the turns, so.
Rory, I think the numbers you gave, 57 hospitals out of thousands.
But that's what I read. Now, that could have changed, so it's certainly not the majority.
And it's probably changing daily, but still it's a indication. It's another example of where your care at JPS is going to be exceptional, and it especially benefits our senior population.
I think that's a fair statement.
Yeah. And your
I'm sorry.
I was going to say, in your experience is exactly what we're trying to prevent. It's when you get a hospital acquired pressure injury, it takes a long time to recover from that. It's very costly and also very painful and for the patient.
Is this the only type of product on the market?
No, it's not. There's other people that have different technologies
So the 57 is just who use this technology?
on the website. Yeah.
Okay, any other discussion? All right, then I will call for, Blake, does that satisfy you?
Yes, and thank you.
Okay, great. I'll ask you if you'll make a motion to approve the finance, planning, and investment consent agenda items.
I move to approve the finance planning investment consent agenda.
Thank you. Second?
Second.
Second by Leonard. All in favor?
Aye.
All right, motion passes. Thank you. All right, let's talk about the consent agenda for the governance committee. I guess, Blake, your main concern was COM 9000 corporate compliance program.
Yes.
Okay. Okay. Go ahead.
Okay, so I wanted to visit, and Colin and I talked a lot. We also spoke with governance about a couple of specific
concerns that I had, and Colin and I have spoken several times since then. I had two concerns with the compliance program, but before I state those, I hold compliance in the highest importance at JPS. I work in a high compliance industry, and so compliance is a part of every day of my life. And I thank Colin and his team for the great work they do. And at the governance committee meeting, it's amazing the reports they present to us and the amount of audits that they go through. My concerns with this program as presented were, one was very specific. I wanted to clarify that board members are not deemed to be volunteers on this document. So that's a very specific request. We discussed that at governance, and I don't think there was an objection to that. Some felt it was sort of obvious already as written, and I just would like a sentence stating that board members are not deemed to be volunteers. And if you read through the whole document, it matters as to what your obligations are, as to whether you're a member of the workforce or not. Volunteers are a member of the workforce. My second concern is that we not impose on volunteers or any member of our employee staff unnecessary compliance obligations. Good compliance keeps you out of jail. Great compliance keeps you out of jail and allows you to do your job and run your business. And so I don't want to put unnecessary burdens on any member of our workforce where it's completely inapplicable. And so Colin and I have talked about different ways to achieve that goal. One way would be to give him discretion in this document to exclude certain categories of the workforce from specific obligations that the program requires. Another one would be to, very carefully, surgically edit the document to make it clear where it applies or doesn't apply. A third approach might be that we approve it as is, and then we meet again in a few months after Colin's had a chance to run with it, and he may have want to edit it after he's had a chance to run with this document as a living document. And then I asked Colin if he would speak today about my concerns. And I asked him a couple of questions, and I got surprising answers. And I'll lead into your discussion, Colin. I asked him one question this morning. I said, do the volunteers at the visitor information desk need to have START training? And Colin said,
I said yes, because vendors would check in at the front desk, and they should know if it's an approved vendor or not, or an excluded vendor. So, second piece first, which was unnecessarily burdening staff. And so, as I told Blake today, I think the corporate compliance program needs to be looked at as the floor, not the ceiling. And so what we're actually requiring from an education standpoint for workforce is EMTALA, general compliance training, which is how to report things with a general perimeter of regulatory issues that impact healthcare, HIPAA, infection control, IT security awareness, patient safety, and workplace violence. That's what we require for basic compliance training, and I don't see a scenario where I would exempt anybody from our workforce in taking those things. I would be, and the reason I suggest taking it back is I don't want to accidentally exempt somebody, a volunteer from hand washing, for example, was the example I used, and then have infection spreading all around the hospital. I need to understand those downstream impacts if we're going to exempt somebody. So that was that piece. The other thing I would say broadly is that historically, as this program has been implemented here for a couple of years and 2 years elsewhere before that, and the program that I had before that and CareSource where I worked before that, this has historically not been an issue. And so the entire program itself is dedicated upon risk. And so I don't necessarily see the risk or the problem that would require a solution to amend the program. That being said, in the interest of honesty, I don't have a strong opinion one way or the other. If the board wants it, we can implement it. I don't think that additional language, as I've heard proposed, would at all change the way the program is administrated or functions. That's how I see it, and so I don't know the necessity of the change if that's going to be the case.
So the plan that we have in our books that I've read through is the plan that was approved and forwarded for approval at this meeting by the governance committee.
That is correct.
And the members of what was the vote at the governance committee was this? I wasn't at the governance meeting, so I don't know if it was much discussion, or if it was a unanimous decision or whatever else?
Not unanimous, but it's majority.
Majority? Okay. And so, and what you're telling me is the detail specificity that Blake is looking for might be good, but not necessary, or not required for this plan?
I would agree with that.
Okay. And so, and is that on both issues, the exempting certain people as well as a definition for volunteer?
Yes.
Okay.
Mr. Chair?
Yes.
I have a different opinion. First of all, I think any discussion outside that has to do with the committee needs to go back to the chair so I can be in the loop, because I'm out of the loop on this one, which is kind of inappropriate. Secondly, I know we are appointed by the Commissioner Court, right? So we are not volunteer, but we opt to volunteer for something. We're subject to everything that everybody else goes through. I'll give an example. If we volunteer in an area where our kids involved, obviously background check will be required. If we exempt from that, things may happen, and we don't know. And I don't think it's prudent for us to ignore the fact that when we step outside of our role as a chair and we go inside and volunteer for something inside the hospital, we should be in compliance on every area aspects of it. So that's just my opinion on it. Because you can't have a blanket approval and say you exempt from everything. That doesn't apply to board members.
Okay. Go ahead, Blake.
Colin, under this document, do you consider board members to be volunteers?
I do not. In COM 9000, on page 70 of your books, board member, JPS board member is pulled out and specifically defined as I believe, an appointed position by the Commissioner's Court. By my interpretation, that separates board member from any other type of person that works or does business at JPS.
But there's no definition of volunteer in this document?
There's not.
Okay. So there is room for confusion, disagreement by a reader of this document as to whether a board member would be a volunteer. I consider myself a volunteer. Others around this table may not consider themselves a volunteer. I would like to make it clear that what your intent is, there's no arguing over what your intent is with board members. Yes, if I go into other duties here, I'm going to be subject to whatever the compliance requirements are of those duties. But as a board member, if I'm not a volunteer, if that's your intent, I would like to make it clear.
Okay.
I guess I'm a little confused. I'm a little confused because I think it is clear that we are appointed to the board. If I wish to volunteer to do something else besides serving on the committees that's set forth in our bylaws, then I would be going through the volunteer department who has a job description that says what a volunteer will do. I would be applying to be a volunteer for a specific something, and it is there that it would define what that role would be. But I do not see myself as a volunteer for serving on this board. I'm appointed to this board. And it's just because I don't get paid for it, it's still an appointed position. So I don't see a reason to change it.
Amanda?
Yes, yeah. The delineation between an appointee and a volunteer. I feel like our description is outlined within this compliance document, and also the documents that we sign are very different from the documents that a volunteer signed too, regarding our access, regarding our information. I think that compliance has covered that for us to be able to delineate our duties between volunteer and appointee as a board member.
So if everyone agrees we're not volunteers, why not add a sentence that says we are not volunteers?
I guess I don't understand why we need to.
Yeah, I mean, why would we not include that in J on page 70? That for purpose, when we're in our role as a manager, I mean, I think the point is valid, that if I come and volunteer, I'm subject to all of those things. But when I'm here as a manager, I'm not in that other role. I think it's important to clarify.
I can clarify it. I don't, what does it damage us?
That's my question. I don't know the.
Damages us if we need to clarify it, let's clarify it.
So what is the
Blake, is your
timeline?
concern that as a volunteer, some of that might bleed into what we do here?
Exactly.
Yeah.
But how? Okay. If this goes back to committee, what does your time frame look like? What does that put us at?
Probably 3 months from now.
Does this need to be in place now?
This was a package of amendments, and so the program itself is already in place. And so
Okay.
if it requires further amendment, that's not a harm in any way to JPS.
Ask, what do our bylaws say? Because we are governed by what our bylaws say. Am I correct on that?
Yeah.
Right, and so I'm just trying to figure out why in this plan would I have an additional statement that says I'm not a volunteer? I'm a appointed board member with these duties, and it's outlined by our bylaws. If you want to change, then put it over in your bylaws. But I wouldn't recommend that either.
I mean, what are you foreseeing?
Dorothy, the reason that I've raised it is the definition of workforce in this document includes volunteers. I consider myself a volunteer. I respect that some of you don't think you're a volunteer. That's fine. That's not a big deal. But I think I'm a volunteer. And others may think I'm a volunteer. And if you look in the dictionary, I think, a volunteer. I don't want to be brought into, because when you write a compliance document of any kind, now you have to follow it. Now you have to follow it. It's worse to have a document you don't follow than to not have a document at all. And so I don't want someone observing this document to say, well, the board's volunteers, why aren't they going through all this training? Well, we're not volunteers. Let's clarify that so there's no dispute with one sentence. And then we all agree that under this document, we're not volunteers. I think it's unanimous. I just want to say we're not volunteers.
Okay. I guess I don't care. I don't believe I'm a volunteer because I have a sworn fiduciary duty to the position that completely removes me from a volunteer. Now, if I want to go down and hand out popcorn downstairs, that is me as a board member volunteering my time to hand out popcorn downstairs.
But you got.
Wait, is there popcorn downstairs?
Popcorn, or there was. So I guess for me.
You gotta get a flu shot.
For me personally, I will lean on our compliance officer as to whether or not it's necessary, whether or not it matters, or I can lean on all of you and someone make a motion and we can go one way or the other, or we can send it back to governance to discuss. I don't know that we need to. If it's just a sentence, we could probably take care of that here.
For me, I adhere by compliance a lot also as well, because when I was running a public company, I'm subject to SEC and all that stuff, right? And when your bylaw and you appoint it and you sign and swear in and we take classes and we know we'll be prosecuted for some wrongdoing, unlike any other volunteer. So we are not volunteer at all. But when you cross over and you put it as a volunteer, we're not volunteer, and it address volunteer, and then when you volunteer, it makes it very confusing. And it's going to, when you have confusion, that's where you have, all kind of challenge and complaint and all sort of things. So this is one of the cases where less is better because it should be in our bylaw, by bylaw over dictate and approved by the state and the county already. And that's, protection, we all want protection. We're here to serve and do the right thing, but the protection is already there. I think, as you mentioned, more is actually hurting more than help when you go to per section, and then every one of the policy would have to dictate at the very front, board member are not volunteer, and make it consistent throughout every single document you have down there.
with respect, I think all we'd have to do is on J there on page 70, just say for purposes of this document, volunteer does not include a member of the Board of Managers.
But then when they volunteer, then it's confusing.
I mean, I don't think so in this sense.
Right,
As I read that.
because that doesn't apply to them. If they already declare that they board member are not volunteer, and then when they volunteer, then we're above the law.
Okay, so then how about for purposes of this definition, this does not include a board member when serving in his or her capacity as a member of the Board of Managers?
As any good attorney would say.
I think you're always serving as a board manager.
I think, yeah.
I don't think so.
You're,
I mean, you all just talked about all the statutory duties and obligations. I'm with Blake on this now, now that I hear this. But all the statutory duties and obligations that we have, those are defined. That wouldn't include passing out popcorn down, well, unless.
And if you want to do it, you have to go through volunteer.
That's right, that's right. And I think this is the way to clarify that. Right.
So the same premises is if I wanted to volunteer, I would go to volunteer services, I'd have to go through some additional things to be able to do that.
That's right.
Yeah, so.
I'm kind of with Tim on this from the standpoint that what does it hurt to clarify it? I mean, it doesn't, I don't think that creates more ambiguity. We're just clarifying the document. I mean, I don't understand the difficulty of this. Why is that hard?
Oh, Daphne, you want to speak to our internal?
So just listening to the conversation, I do think that Colin and we can give a definition of volunteer that makes clear, I mean, because that's where I would do it. I don't know that I would carve it out of the definition of board member. We'll just add what a volunteer is for our purposes and for purposes of this document. And I think, we can work on that language. It'll make clear what a volunteer is.
can we work on that language today to approve this policy and get
Do
it
you
moved
have
forward?
something that you can read that you have in front of you or no? Do you have any definition in front of you that you can read?
I do not.
You don't have it in front of you? No.
Okay.
And Roger, regarding my other issue as to what obligations should apply to what classifications of the workforce, I'm comfortable. I wanted to raise it, but Colin and I have talked about that a lot, and I respect him very much. I think other than this one issue we've discussed about the board members, I'm comfortable approving the document, but Colin should be free to come back to us at any time to edit this. This is a living document. He may see something next month and say, oh, this is a problem. This isn't a once-a-year thing.
Yeah,
This is when he says when he...
I think that is implied, but simply by his position. This board would never turn down compliance's ability to update anything necessary for us to be on the straight and narrow. So I think that's implied automatically.
We bring all kinds of plans.
And we've just, yeah.
So with
Okay.
adding a definition for volunteer that clarifies the distinction,
Okay.
want to take that?
So what we will do is we will, I don't know, DT, that we need to bring this back to governance if it's a simple definition. We will.
It's a simple, just bring it back here.
Yeah, we'll table this agenda item until next month with clarifications on the definition of volunteer and move forward then.
Why don't we approve as it is with that language change? That way the whole board can meet instead of going back to the committee to meet 3 months from now.
Okay.
Why don't we do that?
So approve as is.
As is, plus,
Amended the next month.
Subject to amendment.
yes,
Kind of
come
like
back.
the Bill of Rights.
Yes, the amendment.
Just like that.
We good. Accept any motion someone wishes to put forth. How's that?
Well, I have one more question.
Sure.
Where does this live? Like if I want to see this in the future, where do I go to find it?
So for staff, it's on the intranet of the organization in a couple of different places.
Okay.
It's also part of their annual education, same with the code of conduct.
What about me?
For board members, I will give it to you.
Well, for the final document, you'll be able to access it.
Oh, there you go.
The portal?
Board portal.
Okay, so I'll accept a motion either to table or I'll accept a motion to pass as is or to.
For clarification with.
To
Well,
add
I've
the
got-
definition of what a volunteer.
governance.
I'm sorry?
Isn't he passing his?
No, we're
No,
going
I'm
to go
trying to
back to
bring
the
it
board
back
meeting.
straight here and bypass governance. That way it doesn't take 3 months to do it. So,
So we have to approve it subject to amendment. This board.
okay, so I'll look forward, but I've also got these other two. So COM 9000 reference, or there's references of COM 9000 in LD 1200. Does that need to change? No. Okay, so then how about this? On the governance consent agenda, can I ask for approval of items A1 and A3?
So move.
So moved by TT. Second by Leonard. All in favor?
Aye.
Any opposed? Okay, now I need a motion to approve with pending amendments, item number, under governance consent agenda, item A2.
So move with the language, with the approval, with the condition that will come back once they have the language to clarify what volunteer duty is. Or
Okay, do you want that to come back to governance or to this committee?
To the board.
Full board,
next month.
okay.
Yes.
So the DT has a motion to approve COM 9000 with the caveat that the changes are brought back, the definition of volunteer is brought back to the next board meeting. Second.
It's a good motion.
Any more discussion? Okay.
Second.
Is there a second? Second by Trent. All in favor?
Aye.
All right. Thank you all very much for that. That was fun. Okay. Now we will move into executive session. We've got a few items to talk about at 2:27. We'll come back in about 5 minutes. Thank you. We reconvene from executive session. Being no further business, this meeting is adjourned.